ligaments ma chai anterligament of malleus, sphenomandibular ligament. If you read like this, it will be easy for you to remember. So second is also known as the hyoid. So nerve is the facial. So it supplies the muscles of facial expression, the stapedius, stylohyoid, and the posterior belly of digastric. The cartilages are the skeletal structures ma stapes, stylohyoid process, lesser cornu or upper part of the body of the hyoid bone. Ligament ma chai stylohyoid ligament. Now come to the third ma chai glossopharyngeal. The muscle, the only muscle is the stylopharyngeus. And the skeletal structures are the greater cornu and lower part of the body of the hyoid bone. And the fourth part is this one, the superior laryngeal branch of the vagus sinus, or could say the recurrent laryngeal branch of the vagus. So the muscles are cricothyroid, levator villi, constrictor of pharynx, increasing muscles of larynx, or striated muscles of esophagus. And the cartilages are all the thyroid cartilages, or the cartilages of the larynx, or the thyroid, cricoid, arytenoid, corniculate, and the cuneiform cartilages, or you can say the cartilages of the larynx. Now these are the derivatives of the pharyngeal arches. And also important is the cervical sinus. So what do you mean by the cervical sinus? So all these are developed during the end of the 4th week. During the 5th week, the second pharyngeal arch, it starts to enlarge. So here also you can see. So this is the first pharyngeal arch, this is second, this is third, this is fourth, and this is the 5th. Right? So during the 5th week, so during 5th week, what happens? The second pharyngeal arch enlarges. Okay, so here you can see. So this is first arch, your second body. Of the second pharyngeal arch, it starts to enlarge, and it even overgrows the third and the fourth arches. Okay, the second enlarges and it overgrows even the third and the fourth arches. So what happens during this process? There will be a formation of the ectodermal depression. Okay, so there will be a formation of the ectoderm, because this outer part is the ectodermal lining. So there will be a formation of ectodermal depression in this ventral part, so which is known as the cervical sinus. Okay, so during the 5th week of the result in the pharyngeal apparatus, there will be a formation of the cervical sinus. And how the cervical sinus forms? The second pharyngeal arch, it starts to enlarge and it overgrows the third and the fourth arches. And when it overgrows, here you can see, so this is the ectoderm, isn't it? The external part is ectoderm. So here there will be formation of the depression, which is known as the cervical sinus. So here also you can see. Your part, this is the endodermal part, the yellow color part. You say mesoderm boy, so this is the ectodermal part. So here you can see. So there will be a formation of the cervical sinus here. So this is the cervical sinus here. And by the end of the 7th week, the second to the fourth, your second, third, fourth, you can see here. So this is the first boy, second, third, as well as the fourth. By the end of the 2nd week, the second to the fourth pharyngeal clefts, and as well as the cervical sinus, they disappear. Okay, so by the end of the 7th week, the second to fourth pharyngeal cleft. So here you can see, there is no clefts here. So you can see only one pharyngeal cleft here, and there are no clefts here because they all disappear. The pharyngeal clefts and even the cervical sinus will start to disappear by the end of the 7th week. Okay. Now the pharyngeal clefts are normally there are 5 pairs on each side, so you can see all of them they disappear, except the first pair. So this is the only one pharyngeal cleft remaining here. Right? This is the only one pharyngeal cleft here, and this will give rise to the external ear as well as the external acoustic meatus. So pinna, or you can say the external ear or the external acoustic meatus. So what they write in the development of the external ear? So it develops from the first pharyngeal cleft. So is this clear? How the external ear is formed? They all disappear. So only one is remaining. Only the first pharyngeal cleft remains. Rest all times they disappear, and this will give rise to the first pharyngeal cleft will give rise to the external ear, that is the auricle as well as the external acoustic meatus. Okay, so rest all disappear. Okay, so rest of the clefts they disappear. Now, at the end of the 7th week, not only the clefts, even the cervical sinus, it forms at the end of the 5th week, but even it has to disappear by the end of the 7th week. Now, sometimes what happens, it remains. Some part of the cervical sinus, it remains, and whenever it remains, it results in the formation of the certain conditions like the branchial cyst, or the branchial fistula, as well as the sinus. Okay, so even the cervical sinus has to disappear, but if it remains, if it persists, it will give rise to the formation of the branchial cyst, fistula, as well as the sinuses. Coming to the pharyngeal pouches of clefts ko only one remains, rest all disappear. And now coming to the pharyngeal pouches, over here you can see. So the pouches are endoderm. So these arches are lined internally by endoderm, and this cleft is known, cleft or the groove is known as the pharyngeal pouches here. So again you can see the 5 pair. And this 5 pair of pouches, 1, 2, 3, 4, 5. So each consists of the ventral part as well as the dorsal part. Right? Ventral part as well as the dorsal part. Of a ventral part of the second as well as the first pouch, they atrophy. So this is the ventral part of the first. The ventral part of the second, they usually atrophy. Okay. So only the dorsal part, of a dorsal part of the first part as well as the second. So here you can see the dorsal part of the first and the dorsal part of the second, so they unite here, and this will give rise to the tubotympanic recess. Okay, so can you make out this recess here? So this is the tubotympanic recess. So this will give rise to the lining of the pharyngotympanic tube and as well as the middle ear cavity, and this will give rise to the middle ear cavity. How the middle ear cavity is formed? Of auricles externally, so it develops from the cleft boy, whereas of your inner part, just the middle ear cavity, it is inside, so that develops from the, it is endodermal origin, so that develops from the first and as well as the second pharyngeal pouches. Okay, so first or second, our ventral part atrophy boy, second part unite, and they will give rise to the tubotympanic recess, which will further give rise to the pharyngotympanic tube, middle ear cavity, and even the mucosal lining of the tympanic membrane. Okay, so tympanic membrane ko mucosal lining one is my answer. Our rest of the dorsal portion, over here you can see the remaining part of the dorsal portion, right? Remaining part, so that will give rise to the palatine tonsil. So here you can see this is the palatine tonsil. Of the remaining part of the dorsal portion, it will give rise to the palatine tonsil, the second one, sorry, palatine tonsil. Now come to the third pouch. So this is the third pouch. Now come to the third. So the ventral part of the third pouch. The ventral part, dorsal part. Ventral part, dorsal part. Of the ventral part of the third pouch will give rise to the thymus. So this is the thymus, whereas the dorsal part will give rise to the inferior parathyroid. Inferior parathyroid third. So this is the ventral part, thymus. Our dorsal part would say inferior parathyroid. And the ventral part of the fourth pouch. The ventral part of the fourth pouch, it will give rise to the lateral lobe of the thyroid gland. It is lateral lobe of the thyroid gland, whereas the dorsal part of the fourth pouch here, so this will give rise to the superior parathyroid gland. Okay, so you say external ear, external ear, and auricle and external acoustic meatus, and as well as the tubotympanic recess, middle ear cavity, even the mastoid antrum, and also the mucosal lining of tympanic membrane, the palatine tonsil भयो. अनि third को पनि the ventral part thymus, dorsal part चाहिँ inferior parathyroid, अनि fourth को ventral part the lateral lobes of the thyroid gland, dorsal part चाहिँ the superior parathyroid gland. Now coming to our pharyngeal membrane. So what do you mean by pharyngeal membrane? See the ectoderm of the pharyngeal groove. You say pharyngeal groove, ectoderm. So the ectoderm of the pharyngeal groove, when it joins with the endoderm of the pouches. So the union of the ectoderm of the groove, and the endoderm of the pouches, they unite and they form the pharyngeal membrane. Right? Membrane. When the ectoderm and endoderm unite, and this will give rise to the pharyngeal membrane. Okay, and these pharyngeal membranes will also disappear. That's fine. So these pharyngeal membranes also disappear, except the first one, and that will give rise to the tympanic membrane. Okay. Now coming to the anomalies of the pharyngeal arches. Okay, so different anomalies of the pharyngeal arches. So what are the different anomalies? So the branchial vestiges, So what is branchial vestiges? Normally, as I said, the pharyngeal cartilage also they disappear, right? Pharyngeal cartilage also disappear, But remnant of these pharyngeal arch cartilages, so when they appear under the skin in the side of the neck, so they are known as the branchial vestiges. Normally it has to disappear, but if it remains, it will give rise to the branchial vestiges. Now you must have seen the branchial cyst also, so branchial cyst. So this is the sternocleidomastoid muscle border, which is usually common. So this is the anterior border. Your sternocleidomastoid, this is the anterior border of the sternocleidomastoid. So these are the sites for the formation of the branchial cyst as well as the fistulas. Okay, the cyst is usually custom, it is cystic swelling, oval, and it is painless, and they are usually found along its anterior border of the sternocleidomastoid muscle. And this also occurs because of the failure of the obliteration of the cervical sinus. And if the cervical sinus has to disappear, so if some part of it persists, it will give rise to a branchial cyst, and which is common along the anterior border of the sternocleidomastoid. Now coming to the branchial sinus, the branchial sinus usually occurs due to failure of the fusion of the downgrowth of the cervical sinus with the sixth arch. The cervical sinus, it usually forms when it fails to downgrowth up to the sixth arch completely. So this will give rise to the branchial sinus. Then there are branchial fistulas as well, and that's the set of the fistulas means it also develops along the anterior border of the sternocleidomastoid. So these are the common sites for the cyst as well as the fistulas. Okay, they develop along the anterior border of the sternocleidomastoid muscle, and most common is just about the sternoclavicular joint, and it is also due to obliteration, incomplete obliteration of the closure of the cervical sinus. So these are the common location or the common size of the branchial cyst as well as the fistulas. So whenever there is obliteration, cervical sinus, that will give rise to cyst, the fistulas as well as the branchial sinuses. Now coming to the first arch anomalies, so you should know what are the different derivatives from the first pharyngeal arch. The first arch anomalies are, so it first arch anomalies, it mainly involves the malformation of the eyes, ears, palate, and the mandible. So the main manifestations, two main manifestations of the first arch syndrome are known as the Treacher-Collins syndrome and the Pierre-Robin syndrome. Okay, so Treacher-Collins or Pierre-Robin syndrome. So what will happen in Treacher-Collins syndrome? Mainly the mandibulofacial dysostosis. So here you can see the mandible as well as the facial dysostosis. You can see the feature here, the mandibular hypoplasia here. So you can see the ear anomalies. So there can be a small ear, that is microtia, anosia, absence of nasopsa, and there can be the malformation of the malleus as well as the incus. So first arch anomalies, there will be deformity of the derivatives of the first arch. So it's the mandible boyo, maxillar boyo, and ear, the microtia, anosia, malformation of malleus and incus. And even you can see the eye anomalies like downsloping palpable features, and you can even find the associated is a cleft palate. So this is the Treacher-Collins syndrome. Right, mandible, slanting palpable feature here, microtia. The other one is the Pierre-Robin syndrome, and its main features are like the small mandible, microphnathia. Then there will be deformity in the tongue as well. So there will be posterior displacement of the tongue as well as retraction of the tongue on U-shaped cleft palate. So this is the Pierre-Robin syndrome. Right? Posterior retraction of the tongue, there will be cleft palate here. So this is the Pierre-Robin syndrome. Right? These are the main manifestations of the first pharyngeal arch. This is important, right? Pharyngeal apparatus or the branchial apparatus is important. अब you have alveolar, just summary gardens. So they start to form during the fourth week, near the pharynx, and then also the pharyngeal apparatus. Why it is known as branchial, or let's say in fish and amphibians they give rise to gill, which gives rise to the helps in the gaseous exchange, but human no such structures or no such functions are found. Mainly you should remember in a pharyngeal apparatus, all of you try to draw this diagram, and it consists of the pharyngeal clefts, the pharyngeal arches and the pharyngeal pouches, mainly the tinta CAP, and you should also know what is the pharyngeal membrane. That you must know, and when it starts to develop, and that it starts to develop at the 4th week. Firstly, earlier they develop by the mesenchymal cells. Later comes the neural crest cells. They also migrate towards the region of the pharynx and give rise to this, the pharyngeal arches. And they start to divide in the craniocaudal sequence into 6 bars, and that will give rise to the 6 branchial arches. Only 1st, 2nd, 3rd and 4th, so they are visible externally, whereas the 5th and 6th are not visible externally, so you can say they are rudimentary. Okay, so that is you must know. And each arch so there are it consists of the ectoderm, endoderm as well as the mesoderm. That you must. What is arch, what is a cleft, that you must know, and what are the pouches. These are the arches, 1, 2, 3 and the 4, and each arch is separated externally by a groove that is known as the cleft, and it is separated internally by a groove which is known as the pouches. So this is the pharyngeal cleft, this is the pharyngeal pouches. On each arch so this is the mesenchyme, this is mesodermal body. This is mesoderm, endoderm, ectoderm, and each arch it consists of an artery himself. So there is a pharyngeal arch artery, you have already read, I think. And also it has a cartilage, it has a muscle, and each arch has a separate nerve. And what are the different derivatives of your pharyngeal arch cartilage? So this you must know. Or you go figure. And you must know this. You should know this table, the trigeminal nerve, and these are the muscles, the skeletal structures and the ligaments for you. Muscles, skeletal structures, ligaments, and all these issues. You need to remember this figure and how the cervical sinus is formed, and it's called congenital anomalies, branchial apparatus or pharyngeal apparatus congenital anomalies. You should know how the cervical sinus is formed. So during the 5th week, the 2nd pharyngeal arch it enlarges and it overgrows the 3rd and the 4th arches. That will give rise to this ectodermal depression, that is the sinus, and which again will disappear. Which again will disappear at the 7th week, and remnant of this will give rise to the various congenital branchial cysts, fistulas, as well as the sinus. And only one cleft remains, and structures of the derivatives are. In the first part, external acoustic meatus and how this parathyroid gland superior as well as the inferior here, and the thymus, the thyroid gland, and how they are formed. Okay, so this completes. And first arch anomalies, you should know this Treacher-Collins syndrome, Pierre-Robin syndrome. This also you must. And the apparatus, you try to draw the figure. And you say MCQs, especially in the head and neck, whenever you read the muscles of facial expression, muscles of mastication, you remember from which arch it develops, and this get the similar the nerve supply, that also should. It's our class in the pharyngeal apparatus. I have to take attendance. It's an organ. Yes.